thanks for that very kind introduction and the invitation to come here. It's something that I welcome doing. I want, not before I get to talking about what the Center on Poverty and Inequality is doing with respect to poverty measurement, I just briefly give you a backdrop of some of our other research projects. We're divided up actually to 10 research groups, one of which is poverty measurement. But as you see on the list there, we're taking on quite an array of topics, all of which are relevant to poverty, but approach it from different angles. Within the poverty domain, we actually have 4 measurement projects underway. And I want to just give you a sense of all of them, but then I'll turn to the one that's most relevant for today. And the first one is trying to develop. It's all about trying to develop more frequent measurement of poverty. If you think about what the country does with respect to unemployment and employment, we have monthly measurements, right? And the country waits with much anticipation for the release of those data. And our macroeconomic policy and other policy is oriented to some extent around those numbers, those employment and unemployment numbers. If you contrast that to what happens with poverty, I think that contrast is quite stark. With poverty, we have, for example, with the supplemental poverty measurement, we now have a release once a year, and the data that are released speak to what might be understood as the distant past. They're a bit of history, and so there's no possibility of thinking about policy, macroeconomic policy, and other being oriented to those poverty numbers. It's a piece of history that's being reported. There's no opportunity to react to those numbers because they're so old by the time they're released. To react to those numbers, to react to employment and unemployment numbers. And I would contend we should. But to get there, we need, I would think, far more frequent release of poverty data and numbers that are timely. And so we're trying to work to do that. It's no easy task. The data demands are substantial, and what's available is not. But we're using the current population survey. They do have a monthly reporting of income. It's a categorical sort. One can, though, use it to address, as I have on the left-hand side there, the proportion of the population of individuals over age 15 with family incomes below that supplemental poverty measure threshold. And you can track that on a monthly basis. Another measure that we're experimenting with is the number of children living in non-working poverty families. Families that don't have any adult members who are working. It's a new type of poverty. Well, not new, but it's a growing type of poverty in the United States, one that was accelerated during the Great Recession, but in fact has been on an upward climb for some time now. And it's a different type of poverty that demands, I think, a different approach than one that characteristically has been featured in the U.S. Let me turn now to the second project that's underway at the center pertaining to the measurement again of poverty. We focus mostly on simply counting how many people are in poverty. The government does, and that's what we're trying to do also at the center. But that obviously misses a lot about the everyday experience of poverty. And a lot of the policy that has been developed in the United States has been very much affected by prominent qualitative studies of poverty, in which the everyday experience of poverty is explored and reported on, and that has, in many important ways, affected the policy that we've subsequently developed. But the problem with the existing qualitative studies of poverty is that they're one-shot deals. A scholar will undertake a study, report on it, but it's very difficult on the basis of that one-shot study to track trends in that everyday experience of poverty, because each study is different, pertains to a different population, it uses a different method. There's no systematic, regularized protocol that's being applied time and again that makes it possible for us to understand the way in which that experience, that everyday experience of poverty, may or may not be changing. So what we're doing is working now to plan a supplement to the current population survey that would entail a standardized protocol applied to a random sample of the population, but with an oversample portion of poverty, of people in poverty, and then understand their experience in a qualitative way. And if you do that in a regular, systematic way, we'll be able to track trends in that experience. And I would contend be much better equipped to develop policy that responds to what's happening on the ground with respect to people who are experiencing poverty. Third project, and then I'll get to the featured one, It's all about trends in social mobility. There's been much concern of late that those folks who are so unlucky as to be born into a poor family, the stork drops them into a poor family or into a poor neighborhood, that those folks are more likely now to be trapped in poverty over the course of their entire life than was the case before. So opportunity for mobility, many people contend, including President Obama, may well be declining. What's extraordinary again is that we don't know if that's the case. It's often claimed in the press that social mobility is declining, but in fact the data upon which those claims are based is quite thin. We need, again, to have a regularized measurement of social mobility, and we're trying to approach that in two ways at the center. First, exploiting Internal Revenue Service data, of course with all confidentiality intact. We never see the data ourselves. All the analyses are undertaken by the IRS, and all we get then are the aggregate statistics. But that's an opportunity because the IRS asks for the Social Security numbers of children. If you claim them as dependents, you can then track those children as they then enter or don't enter the labor market and assess the extent to which those children who are born into poverty are themselves experiencing poverty later in their life. We're also developing a new national mobility survey that will provide another weapon with which to understand whether or not mobility is in fact declining. So that's it for the little advertisement as to what we're doing at the center. Let me turn now to the supplemental poverty measure and what the center is doing on that front and how we should understand this new measurement tool. It's a bit of a revolution, I would contend. But where the revolution has fallen short and where we're trying to do a bit at the center is developing local measures of poverty. The Census Bureau has been very good in reporting the national measure and also state-level measures, but we lack local measures of poverty that are within the supplemental poverty measurement rubric and can then be compared and used to monitor trend at a very local level. So that's what we're trying to work on. But let me step back and say, well, what's wrong with the official poverty measurement? Let me rehearse the conventional wisdom now as to what's wrong with it. First off, it ignores regional differences in housing costs. So for example, poverty in California, which has very high housing costs, is, by this logic, underestimated. Much of the income that families have to go into poverty, they have have to go into housing, and they have very little left over thereafter. But the official poverty measurement doesn't take into account that housing expenses are higher. Now, of course, some people might argue, this is not entirely uncontroversial, some people might argue, well, if you adjust for regional differences in housing costs, you're also possibly taking into account differences in the actual quality of housing, right? But that will be ignored under the supplemental poverty measurement, that possibility. We'll just move forward and adjust mechanically for differences in housing costs. The second problem is that some types of income and benefits are ignored under the official poverty measurement. So for example, earned income tax credit, a very important anti-poverty weapon, arguably the most important anti-poverty weapon in the United States, is utterly ignored under the official poverty measurement. So too are food stamp payments. Again, a very important anti-poverty weapon, and simply not taken into account under the official poverty measurement. Because these two and other important weapons that are used to attack poverty are ignored under the official poverty measurement, it makes it look as if there's nothing that can be done. So no matter how much we pour into EITC, or how much we pour into food stamps as a country, it's going to have no effect on the official poverty measurement. Not because it has no effect on poverty, but because the official poverty measure doesn't take into account those sources of resources for poor people. And then finally, the official poverty measure doesn't take into account individual differences in child care and health costs. These are extremely important. Health costs can often drive people, as we all know, into poverty. And child care is also a very important part of doing business. If you're going to be working, you often have to pay for child care, and that should be reflected. That expense should be reflected in any measure of poverty. So the supplemental poverty measure is intended to take into account and address these problems. You may not think adequately, there's lots of controversy about it, but the intent was to take those problems into account as well as others, but I listed some of the most important ones. So how does the supplemental poverty measure work? It's really a three-step dance. First, you establish that poverty threshold, right? What is the line? In fact, there'll be a set of lines. But what is the line? If a family falls below, it will then be deemed as being in poverty. So you got to first establish the threshold. Then you have to calculate family resources, right? And determine whether or not that particular family is above or below that poverty threshold, and then you're in business. The third step is just to make that judgment if they're above or below the threshold and deem them as in poverty accordingly. So let me march through each of those steps in a relatively straightforward and simple way. Let's start with the threshold. What did the official measure do? Over a half century ago, calculated the cost of a minimum food basket, and then just multiplied by 3. On the argument that you need more than food to get by, you roughly need 3 times as much as that cost of a minimum food basket to get by, and so we'll just multiply that by 3. That was done once, long, long ago, and then that number was just updated by the Consumer Price Index. And that's that. I'm simplifying a little bit, but it's not that far off. So what's the supplemental measure do instead? Well, first off, the basic needs that are covered within the supplemental measure in defining the threshold is food, clothing, shelter, and utilities. We have a survey that assesses how much people spend on food, clothing, shelter, and utilities. And we can then just, by virtue of that survey, ascertain where the 33rd percentile of expenditures is. And that's where the threshold is going to be set, after you multiply that by 1.2. Because even food, clothing, shelter, and utility don't take advantage of all the basic needs that people that are entailed in living in this society. So it's argued we need to add a little bit more, and so 1.2 is arbitrarily the number by which that 33rd percentile expenditure level is multiplied. And then it's going to be updated every year, but in a moving average fashion. We add in the last year, but we take into account the prior 4 years as well. So 1 additional year is added in each year, but the last 4 years are also in the mix, and that then smooths out the change over time in the way in which those expenditures change. But change is built into this measure, right? And that too is another point of controversy. Because you might ask, well, why would expenditures on food, clothing, shelter, and utilities change over time? It could be that simply, say, in the Bay Area, housing prices go up, right? And so people for the exact same houses are spending more money on housing in a way that could affect what we see in the 33rd percentile, right? We would think that's pretty appropriate, I would suspect, to take that into account, right? People are paying more for the exact same housing. There's nothing they can do about it, and we should adjust the threshold accordingly. But they could also be changing the type of housing that they get, right? That also would be built into this measure. And some people might think that's more problematic. But the basic rationale for allowing some increase over time is that it costs more and more to do business in this society. To be a meaningful, participating member of this society takes more and more. You need a cell phone, you need a car. You didn't need those 100 years ago in order to work, but you do now, or to get a job. And so some sort of updating is necessary as regards what our understanding of basic needs are. So that's how the basic threshold is established, but there are many modifications to that threshold that react to circumstances in which families find themselves. The official measure, by contrast, has relatively few adjustments. There's no geographic adjustments. If you find yourself in a region in which housing costs are high, the official measure doesn't take that into account. There's no adjustments by shelter type, and I'll talk a bit more about that subsequently. There are some adjustments by family type, like how many children you have and so forth, but those adjustments have been seen as very problematic. So what does the supplemental measure do? First off, as I've already said, it takes into account differences, regional differences in housing costs, in particular rental costs, because we can measure that well. So it takes into account housing costs in each metropolitan area, and then also makes state-level adjustments for non-metropolitan areas as well. Then secondarily, there are differences in the threshold by shelter type. So for example, if you're, say, an older person who's paid off your mortgage, you own your house, you paid off your mortgage, you have less substantial housing costs, right? You have very few housing costs once that mortgage is paid off. That's taken into account. So you have a different threshold for people who are in that circumstance, people who own their house but have paid off their mortgage. There's also a different threshold for owners with a mortgage and then for renters. So there's three classes. With the argument being that you need different amount of resources depending upon which class into which you fall, because you've got different sorts of non-discretionary payments. And then finally, there are adjustments by family type. Obviously, it matters, say, how many children are in your family, and there's a so-called equivalent scale that adjusts the threshold to take into account these different family types. That's it. So those are the thresholds. It's really not that complicated. There's some adjustments to the thresholds to take into account different situations in which families find themselves, where they're living, what kind of family structure they have, whether or not they're owning and renting. But after that, you just go forward straightforwardly and calculate the threshold it obtains for that given situation. So that's the threshold side. Now let's move to the resources side. We've got to figure out how many resources are available to families and whether or not it puts them above or below that threshold, right? So that's the next step. What does the official measure do? It takes into account your gross before tax money income from all sources. And only cash benefits are counted. So it's not as if all benefits are ignored, but if there are cash benefits of the sort, say, that TANF might deliver, Social Security, unemployment insurance, those are counted and taken into account. But that's it. Just those cash benefits and your before tax money income. What does the supplemental measure count by contrast? Well, it also includes those same cash benefits. But in addition, it takes into account your federal in-kind benefits. So, for example, whether or not you get food stamps, whether or not you have housing subsidies, and most importantly, whether or not you get tax credits through the Earned Income Tax Credit. Those are all going to count as income. And then you have to subtract some things off in the form of non-discretionary expenses. This too is not done under the official poverty measure. So if you have substantial child care expenses or work-related expenses like transportation expenses, that's sort of the cost of doing business, right? That's what you need to do in order to work. So that should be subtracted out. And then also, of course, very importantly, out-of-pocket medical care expenses. That's the cost of just maintaining your body. It's the cost of doing business that has to be subtracted out. And I should say this is very controversial as well. Lots of debate about how to deal with medical care and also child care. And the basic approach is out of pocket, right? Is that very satisfying? I would contend it isn't, because there's a lot of folks who don't undertake the health care that needs to be undertaken. Why? Perhaps because they're in poverty. They don't have the money to do it. They will show up as no out-of-pocket expenses, right? We just ignore that. Although there is lots of work to just measure medical expenses and where people stand with respect to those separately and independently of the poverty measure. And that's the main approach. But as regards to the poverty measure, my own view is that this was a place where probably it under-delivered, and also child support as well. Same deal, right, with child support. Because you're poor, you may not get the quality of child care that you'd like to get and that you should get. But if you don't have those out-of-pocket expenses, then it's not going to show up properly. Here's my cheat sheet comparing the official poverty measure and the supplemental poverty measure. I've gone through most of the contrasts here, so I won't go through it again. I want to talk now. So now I want to talk now about California and the counties within California and how we might apply the supplemental poverty measure so as to develop measurements at the California level and the county level. I should say from the get-go that the project here is very much a collaborative one, in which the Center on Poverty and Inequality is collaborating with PPIC, Public Policy Institute of California. And in particular, I've listed the folks there, Sarah Bond, Carolyn Danielson, and Matt Levin, who have been very hard at work from the PPIC side in developing this measure for California and for California counties. And they're the folks who are doing all the work and that know like 100 times more about this stuff than I do. And so they just have to be appreciated for the work that they're doing here. And I'm just describing it, and perhaps not even adequately, because they know so much more about this than I do. So why would one want to develop a measure for California, a SPM-style measure for California and for California counties? I would say there are 4 reasons why. First off, the Census Bureau does release a California SPM-style measure, but it's based on a 3-year average. And we want a measure that's year-specific. I think the country, I would say the state, is entitled to know, at least on an annual basis. And again, as I've argued, we ought to be measuring even more frequently than annually. But at least on an annual basis, we should have a measurement of poverty. We also need county level estimates, obviously. Counties are in many ways operating in the dark because they don't have an SPM-style measurement available to them, which is very problematic because there's great county-level variability in housing costs to withstand use, EIT, CPC, and much more. And so we need a measure that takes that into account. And so it makes it possible for county welfare directors and others to know where their population stands. It's quite extraordinary that we don't have that, and we need it. One would also like to examine demographic variability in poverty. Not through the official poverty measure, because no one believes that, but through a measure in which we can much more deeply believe, and that would, I contend, be the SPM. We need to know what groups are most at risk, and we really can't do that in any compelling way as it now stands, because we don't have an SPM-style measurement of poverty within California, except what the Census Bureau puts out as a 3-year average. And then finally, and I would say maybe most importantly, what we can do once we have this measure is engage in all sorts of counterfactuals that are extremely productive in setting policy in a way that the people in the state want to set that policy. So we could ask, for example, a question and provide an answer, maybe not an entirely convincing one, but a good first cut at that answer, as to what would it mean if we, say, ramped up EITC by 10%? What would it do for poverty? How many people would be taken out of poverty if we did that? This measure, once it's available, will allow us to ask that question. Or what would it mean if we engaged in stimulus again of the sort that we did earlier on in the Great Recession? What would it mean if we undertook a stimulus of that sort, even now, in terms of reducing poverty? We should know that. How can we set policy without knowing what the effects of possible policy moves are? We can't. It's very successful. And this measure, once it's available, will allow us to undertake those counterfactuals, ask the questions that we need to ask, and then at least make informed decisions. If you don't want to spend EITC, you should at least know what that means in terms of how much poverty is going to be generated by virtue of making that decision not to ramp up EITC. If you want to reduce it, you should know what it means in terms of how many additional people will be in poverty by virtue of the decision to reduce those payments. You should know that. Then you can let, under this ideal typical vision, let the democratic process play out and make those decisions, but at least they should be made with full information about what the implications of those decisions are. So we're going to produce, and the target date is September 2013. We're going to produce a measure for California as a whole. Again, this is in collaboration with PPIC. A measure for California as a whole, and then also county-level measurements, including Santa Clara County. In some cases, as you'll see, we're going to have to pool counties, simply because we don't have enough cases. That's unfortunate, but is just a natural consequence of the data set that we'll be using it, and I'll describe that subsequently. So yeah, we turn now to that very question of the data sources. The fundamental source is the American Community Survey. And in addition, though, because the American Community Survey doesn't contain all the information that we need to estimate the supplemental poverty measure, we're going to have to make imputations. We're where the imputations are based upon evidence that's available within the current population survey. A much smaller survey, too small to be used at the county level in California, but it provides lots of evidence that we need about, say, medical and child care costs. So what we do is figure out who has medical and child care costs in the CPS. We figure out what types of people have high child care costs and medical costs, and then we use that information to make guesses about who's likely to have high medical and child care costs within the American Community Survey. That's the best we can do. Although it does get a bit better than that, because we have administrative data in California. Extremely important. This is where we can actually do far better than what, say, the Census Bureau can do, because we can bring those administrative data to bear. We know at the county level how much CalWorks is being used, what the food stamp use is. We have those case level counts by county. And so we can make sure that those administrative data are correctly reflected when we build the SPM estimates at the county level. And that's, I should say, that's what the folks at PPIC are doing in particular, is using those caseload counts by county, building them into the estimation, and making sure that we're properly taking into account what's being done to assist people in poverty. And then after that, our best estimate of where poverty stands. So as I said, this is going to be coming out in September 2013. What are we going to learn? Well, we'll learn which counties have the highest and lowest poverty rates, which groups have the highest and lowest poverty rates, in which counties are poverties emerging, because we're going to go back in time as well, and so we'll have trend data, and we'll see where things are deteriorating and where things are improving. And then most importantly, again, we'll find out which programs are doing the most poverty reduction work. And we can again play this counterfactual game and try to make decisions with full information about what we need to do in order to reduce poverty. Let me give you just one example of what's been undertaken with respect to counterfactuals in a state that already has an SPM measure, which is Wisconsin. They were the leading state, along with New York, in developing a supplemental poverty measure very early on. They've been extremely important in helping other states, like us in California, develop the SPM as well. We're lagging behind them, and they've been extremely helpful in sharing all they know about developing these local measures. So here's some data that came out actually in Pathways magazine, which is the magazine that the Center on Poverty and Inequality puts out, from Wisconsin, which shows what would have happened. Here's the counterfactual question. What would have happened if the American Recovery and Reinvestment Act, the so-called stimulus, had been applied in 2008, earlier? How much poverty reduction would have been secured if we just applied those same program changes in terms of funding earlier? And the answer is that we would have reduced poverty by 1.3 points via tax credit expansions, additional payments to Social Security recipients, SNAP benefit increases. That's at the all-individual level. In terms of children, the reduction is more substantial. It is 1.7%, as you see on the right-hand side. So you get a pretty big bang for the buck with respect to poverty reduction had you applied the stimulus earlier in 2008. That's all I have.